Hi again, guys. It's Dr. Ketchy. Today we'll be talking about exercise in pregnancy. Yay! Okay, so as far as exercise in pregnancy is concerned, I get at least two questions concerning it. Some people are worried that it may increase risk in pregnancy, and some are wondering what the benefits of exercise in pregnancy are. So let me tackle that briefly. As far as exercise in pregnancy is concerned, if you're healthy and your pregnancy is normal, that is, there is no complications making you or the pregnancy high risk, you can safely exercise in pregnancy. It would not increase the risk of miscarriages. It would not increase the risk of your babies being small. It would not increase the risk of you going into labor early. Okay? Now, as far as the benefits of exercise in pregnancy, one, it could reduce back pain in pregnancy. It could also ease constipation in pregnancy. It's a very common complaint. Yes, it may ease constipation in pregnancy. Okay. Three, it can reduce the risk of you having gestational diabetes in pregnancy, which is basically diabetes that we diagnose in pregnancy. Okay. Four, I think. It would reduce the risk of excessive weight gain in pregnancy. And fifth, or number five, it would also increase the chances of you losing the weight after you're done being pregnant. That's a major concern for some people. Okay, so now that we've discussed the benefits of exercise in pregnancy, and we've talked about who can exercise in pregnancy, what sort of exercise can you do in pregnancy? Two general principles are used. Don't do any exercise that will increase the risk of you falling or hitting your belly. Okay. Already in pregnancy, as the pregnancy is growing, your gait and your joints are a little lax. So you don't want to do any exercise that would increase the risk of you falling and thereby hurting yourself and or the baby. Okay. Now, what type of exercise? You can do any exercise in that category, okay, such as brisk walking. You could do swimming. You could do modified yoga and modified Pilates. Okay, now how long can you exercise for? You could exercise for at least 150 minutes in 1 week. 1 week, 150 minutes in 1 week. So you can spread that out over 30 minutes per day over the course of 5 days, or you could do more frequently or longer time during the exercising. Okay, however way it works best for you. There hasn't really been shown to be any real benefits in exercising more than 150 minutes in 1 week. But of course, if it's within what you can tolerate, we're not going to stop you. Okay. Now, in that 150 minutes, what type of exercise can you do? That would be 150 minutes of moderate intensity exercise. That basically means any exercise whereby you may increase your heart rate, you may sweat, but you should be able to still hold a conversation. Okay. You may not necessarily be able to sing, that's fine, but you should you should be able to hold a conversation while you're exercising. Okay. If you're having to stop and catch your breath too frequently, or if you can't speak while you're exercising, darling, you're doing too much. Slow down. Okay. There is nothing to be gained in that. Okay. Now, the other group of people, some of us, who have either never exercised before getting pregnant or have done it very minimally before they got pregnant. Yes, you may start to exercise in pregnancy, but first of all, like I said, remember, you must be healthy. Your pregnancy must be uncomplicated, okay, or normal, that is. And when you start, please start slow. You could start like 5 minutes and increase gradually, but again, just pace yourself and start slowly. There is no rush. All right. While you are exercising, what can you do? Please wear a good sports bra. Support the girls, okay? Because it will cause less pain for you and less risk of back pain. Okay. Yeah. All right. Stay hydrated. Let me say that specifically. Drink lots of water. Water, okay? Because with that exercise, you're burning energy, you need to stay hydrated. So drink plenty of water, okay? Third of all, do not overheat yourself. We're getting into the summer, And some of us who live in tropical countries, it's hot regardless. Please don't overheat yourself, even while you're exercising. Stay hydrated. Don't lose your breath while you're exercising. And typically, you should be fine. Now, let me say real quickly some examples of patients who cannot exercise in pregnancy. If you have complications in your pregnancy, such as you have threatened labor, preterm labor, your water bag is leaking or is broken, if you have any heart conditions or lung conditions in pregnancy, if you needed a cerclage, that is a stitch during pregnancy to hold the pregnancy a little longer, you do not need to be exercising. Okay. If you have what we call placenta previa, whereby the previa is covering the cervical loss, you really should stop exercising, especially after 26 weeks. Okay. So I will stop here today. Again, I'm here for comments and questions. If you, of course, if you have any other clarifications, you can always ask. But before you start any exercise regimen, please stick to your doctor and make sure that it's healthy for both you and the baby to start, okay? All right, guys, I'll see you later. Have a good day.